This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly FANTASIA, the PH.D. doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
I'm John DeMasi, along with Dr. Molly FANTASIA, the PH.D. doctor, the executive director, and the founder of Innovative Medical Associates. And she's here to talk about everything that they do at Innovative. Well, we'll try to get it in an hour. I mean, that's what we do. And I am living proof that hydration therapy works.
It does. It does.
That's for sure.
I got to give you a lot of credit, though, John. You follow what we tell you to do in terms of your traditional care as well as what we do. Plus, you're watching your diet. You're doing everything. Right.
Yes. Well, they gave me a good scare. That's for sure. So tell us, Dr. Molly, we should mention 855-839-1210 is the number here in the studio, 855-839-1210. Tell us, what is it about Innovative Medical that makes a difference?
Sure. It's easy. We're a collection or a co-op of like-minded healthcare providers who have a belief that we all work out of my primary care facility. That includes the doctors, the nurses, etc. But our philosophy is what really sets us apart from most primary cares. Now, look, you can come in and get a prescription. Everybody's clamoring right now for amoxicillin, right? Because it's on back order. And, although there are many other antibiotics that can work in many of these cases. But the point is, can our doctors write? But we believe the best approach for a patient is to utilize as many things, utilizing the hydration as a vehicle to give the patient some vitamins, minerals, normal kinds of products that you might find in the health food store, natural in nature, to help a patient through their particular condition and to really bypass any of the side effects that you might get from the drugs.
Most of your, or a lot of your protocols are proprietary.
Correct.
We understand that.
Correct.
But can you give us a general idea of what's in the bags?
Yeah, sure. I mean, we can talk about B vitamins. We can talk about amino acids. We can talk about minerals. These are the things you would normally go to the health food store, the drugstore today, pick out and say to the clerk, I want a little something for viruses. I want a little something for my blood sugar, this kind of thing. But it's the methodology and the extractions that I use that actually make the difference, John.
So if you can tell us, like, how many times would you go to your treatments? And
it
and
depends.
Also, what is the difference between the health food store and your protocols?
In many cases, light years is the difference. Number one, you can't get to a therapeutic dose without utilizing without utilizing a hydration vehicle to get enough of the nutraceutical that actually can effectuate the change at a therapeutic level, because you might have to take dozens of capsules. And you and I both know that leads to all kinds of other side effects.
Yes.
So what we don't want to do is put our patient at risk, though. So the balance is to utilize the appropriate nutraceuticals or natural products that we know work in certain conditions at a therapeutic level, that we are able then to effectuate the change for the patient, keep them safe medically, assuming that the doctor says they're okay to take the hydration. And by the way, in many cases,
yes.
So they do need some hydration. So it is a little balancing act, but as I like to say, it works many times more quickly than the traditional remedy, so to speak.
So talk about, let's say I have a bottle of vitamin C in my closet. Okay.
Yeah, sure. Okay.
So I take 1,000 a day.
Yeah.
Tell
Drop
me,
in the ocean.
what's the
Drop.
difference between yours and the
Ours
bottle?
is the ocean. Yours is a drop, okay? And
All
like
right.
a teardrop, right? There's a song like that about a teardrop
Yeah.
that goes in. Yours is the teardrop. So bottom line is you've got to understand. And by the way, it's not just the amount of the particular nutraceutical, but it's the absorbability of that nutraceutical. And let me tell you something. I look at that. In other words, when you put together some kind of protocols, you're looking at synergies of the particular things together, how quickly they can work for a patient, and how quickly the body levels, which is quickly delivered by IV.
And your therapies, your synergies.
Yeah, they're my protocols.
But they're the ones that work.
Absolutely.
And you use them for
26
patients.
years.
Yeah, right.
26 years. 26 years of doing this. And I'm seeing more and more. And as you know, last week or the week before, I did that inflammation test on you. I got them back. When you come in on Tuesday, you're going to be surprised at all the information I've gleaned from that. And it's good. It's good. It tells me that things are working for us.
So that's one of the things that you do.
Yes.
That really is above and beyond.
Yeah, it's beyond the standard of care.
Right.
And we do many, we really try to get as much information for a patient, in particular for their particular challenge, that will help guide us in what kinds of nutraceuticals, natural products, and again, subclinical doses of possibly regular pharmaceuticals to utilize for a patient to move them through their continuum of care.
Talking about how many treatments, because
the
I know
age-old question.
Some people come in and say, well, can I try one?
No.
And really, that's
Actually, I don't even do it.
Yeah,
you
I know you
that.
don't. I know you don't.
I really don't do it because I don't want people to be disappointed, nor do I want them to go out and say this kind of therapy doesn't work.
Yes.
There is a broader mission to what I do. I know this therapy works. So if you don't want to do it with me, well, find someplace else to do it. But doing one is spa-like. You go in, you have a little facial, one time, you look better.
Little Botox, too.
Nah. This doesn't work like that. We're trying to effectuate a change of some kind. I just don't want to put people in the chair. Now, granted, if you are a patient and let's say you've imbibed a little too much and you want to come in, I'll definitely treat you that one time or whatever. But the bottom line is we're trying to effectuate a change for a patient, and many times that really impacts proof. That's the bottom line.
So what is the standard?
It can be as short as 5 weeks and as long as 15.
But for the most part,
somewhere between 5 and 10 treatments, we see change.
Okay, but then after the initial,
you're going to need to do a maintenance, and that's going to be dependent on your ending numbers, how you're feeling, and what we're going to do is say, okay, come back once a month, twice a month, and many times, again, my patients, I like to call, you're a lifer. Yeah. You're a lifer, man,
Yes.
because you have a couple things going on all at once, right?
Yeah, that's
and
right.
then I have cancer patients that stay with me. They're also lifers. They come in maybe every week or every other week to keep the adjunct therapy working and do well, particularly through chemo or radiation. So again, that's going to depend on the patient, how they want to accomplish this. Look, one thing I'm going to tell you, John, I don't hit anybody over the head to say, stay with us. I have people who say,
I've seen people come in like every month.
yes,
But they still come in.
Absolutely.
Because it's just something that
Right.
once you start it,
you're going to want
continue it. Yes.
Not only that, you're going to listen. The bottom line. Do you realize that people say to me, "Oh, the expense of it"? It's really only as expensive as a really good dinner every week.
That's
if
right.
you go out to dinner. One of my patients brought that to my attention. She said, I don't need to spend this money going to Applebee's or going here or going there or having 2 drinks out. She said, I need to spend this money on my health once a week. I want to be able to feel good enough to go out.
Well, we are coming up on our first break of the morning. It is Health Watch. Every Sunday we're here 8 until 9, Talk Radio 1210, WPHT. I'm John DeMasi with the one and only Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates. Our number here in the studio, 855-839-1210. You know what we tell you, always call early if you want to call, so we make sure that we get your call in, your challenge, your medical challenge, or whatever you have, a question for Dr. Molly, 855-839-1210. We have more. We are back here on Health Watch, and as always, operators are standing by at Innovative Medical Associates, and the number is 856-489-0505, 856-489-0505, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And you may want to go to that website because a lot of what we talk about here is really explained in further detail on the website. So it can help you out in figuring out what we do. innovativemedicalassociates.com.
Pretty hard.
innovativemedicalassociates.com is the website. The program is Health Watch, Sundays 8 till 9, right here, Talk Radio 1210, WPHT. Medical challenge for Dr. Molly. Feel free to call in. We were talking about the hydration and your protocols, and so maybe you can explain some of the ingredients
Sure.
in the protocols and what they do, and I guess further help us out. with this.
Sure. Let's talk about some of the traditional things that we use, not necessarily the specialized things that I use synergistically with these. But, for example, B vitamins. B vitamins, everybody knows about them, B12, B complex, that kind of thing. So they're good for energy, hair, skin health, detoxification. Did you know that?
No.
Detoxification. Cofactors in many enzymatic processes. And believe me, enzymatic processes are very, very important, John. Amino acids, John. I talk about that all the time. Athletes, we use that in our athletic protocol. It's extremely important for recovery and helpful for muscle strength as well. So it has two things. And by the way, it's also, amino acids are used in our cancer supportive therapy. You wouldn't think so because we always sort of say, oh, well, that's for athletes. Not necessarily, depending on how you use them. Minerals, everybody knows we need minerals. And if you don't have enough, you'll know about it because you'll see it in bone health. Not good.
Yeah.
And then
Hold that thought. We have a call.
Okay.
Okay.
All right.
We have John in Mount Laurel. John, good morning.
John.
You're on with Dr. Molly.
Hey, John.
Good morning, Dr. Molly and John. How
Hello.
are you guys doing this morning?
Hey, John. How you doing? How you
Morning,
doing,
John.
sir? How you
Now-
doing?
I'm very good. But I called just
Good.
from listening to you over the going on 5 years now, talking about different vitamins and different things. My son just had a test, and his cholesterol was 300. And he
Now, was that? Wait,
No,
John.
no, not-
is that
no.
the gentleman who came in? No, I didn't think so. You know why?
No.
I had the ending number for him. Okay, and it definitely wouldn't have showed that. And I have the rest of his stuff that just came in yesterday when Linda and I were working. So I was going to call him on Monday and say the end was correct, but come on in. I want to show you the rest. But okay. So he has 300.
No, this
Go ahead,
is the
John.
other one. And
Thank you.
anyway, the doctor wanted him to go on statin right away. And he said no.
Right.
And so a couple of things that you've mentioned all the time, he went on them. And
Yeah. Okay.
another vitamin, I forget which one it was. His cholesterol, and 1 month later, was 189. Went from 300 to
Yeah,
189. Unbelievable. I just.
Oh,
I
it's
just
really
had to
not
call in.
unbelievable. Yeah. Thank
Well,
you.
I mean,
Thank you.
they
And that's
put me
he's
on-
taking
they
these.
put me on
yeah.
the statins and the terrible stuff. I'm off of them now. Though, thank God.
Agreed. Oh, I know
Yeah.
that. Hey, John, you're a poster boy for young guys. Come on. You are, But
Yeah.
thank you for the call
No,
because
John is
it's
now.
true.
John is
It's
the
really
poster
true.
guy now. Yeah. All right. I just
All
wanted to
right,
call
all
you.
right. We'll take it.
Those
Thank
two
you.
things that you
Thank
mention
you.
all the time. Okay. Take care.
Thank you. Yeah, God
Thank you.
bless.
Take care,
Now that's
John.
an interesting thing because his son is taking them orally. However, thank goodness he's able to do that, and he had the time to do that because lots of people who come in to see me may have cholesterol that's way off charts, triglycerides that are way off charts, and having overall inflammation in other areas that are contributing to this, and they need a quick hit of what I was telling John's son to do.
Yes.
So again, it depends on your condition and how quickly we need to get some of these things down. But if you're, if you got some other comorbidities like you already have had, a bypass or something, guess what? You can take the same thing that I mentioned orally, and it's a great adjunct to the hydration therapy.
Explain now. We hear that he had a 300 cholesterol.
Sure. Well, not right after,
right,
but probably within 2 months.
2
I would
months.
say.
Now, what did you do, or what did he do?
Well, he
what
started
did you
to take.
recommend?
He started to take some of the things that I usually put into the chelation bag, and I told him to do, take red rice yeast, or I told him to take a few other things. But I also told him to be careful because, alpha lipoic acid. But I'm going to tell people out there, if you have the time to bring it down, okay. But guess what? If you're already a cardiac patient, if you've already had 2 bouts of stenting, if you had a stroke, you maybe not have the time to do that. You can go on the orals after we start to chelate out or claw out some of the cholesterol in order to give you a little leeway there so that, God forbid, you don't have a problem. And that's the key.
Okay, 855-839-1210. If you have, again, a medical challenge or you want to run something by Dr. Molly, 855-839-1210 is our number here in the studio. We were back to the
what kind of
some of the things
normal.
that are in.
So again, with the minerals, okay, it's very important for immune health. And this past year and a half, you and I have been talking about this. We had to look at zinc a lot through COVID, this kind of thing. It also replenishes a lot of nutrient code deficiencies and hormonal health. So that's talking about the minerals. I also use something called phosphatidylcholine, and phosphatidylcholine is something that absolutely supports brain health. I use it a lot in some of our folks that have some anxiety and depression. It also helps data to show that it can help eliminate brain fog and aids in neurodegenerative cases. And again, this is a very interesting amino acid because you have to use it in an appropriate dose for an individualized patient in order to get the result you're looking for. Vitamin C, your favorite, okay? Vitamin C is used where? In adjunct cancer care. It's used in asthma. It's used for allergies, immune support, viral, bacterial infections, clearance. So vitamin C and certain extracts of vitamin C. You notice I'm just using generic, but I have several extracts of vitamin C that I use specifically for specific challenges. Oh, so you know that?
Yes.
Okay. L-carnitine is another one. It aids in weight loss, athletic performance. It helps migraine elimination, and it's brain support. I use something called poly-MVA, which is a combination of nutrients. And what that does is it helps energy for the mitochondria. It's very used extensively in post-stroke and post-concussion. In fact, I was using it on you for a bit. And aids in neuroregeneration. NAD I spoke about last week. Energy. It combats fatigue, it aids in athletic performance, and it helps the mitochondria. So obviously I use that maybe with some of the neurodegenerative types of aminos. So there's a lot of technique here. You just don't throw the stuff in the bag.
You just went through a whole list, and
Yes.
it sounds complicated and it sounds very intricate. Can you simplify it for us? I mean,
I'm going to simplify it. Here's the deal. All of these things are available, all right? The question is, what type of availability is it? When mix with other things, and that's where my protocols come in, because you cannot patent a natural substance, right? Otherwise, the drug company, and by the way, the drug companies are trying to do it.
Yeah, you've been telling us that,
right?
Yeah.
So the point is, it's what you use together synergistically that can aid the patient in accomplishing their quality of life issues, and there is the key on how things are done. And I would say that we've done 26 years of this R&D. In our facility, all the research and development was done between myself and my physicians from the very beginning. And as a result, it's all in-house R&D. And how do we measure that? By the improvement of our patients.
And I can say that when you talk to Dr. Molly in an initial consultation, you can see the wheels turning.
Oh, yeah, I think about things.
I've seen that. And then you go back and you say, you know what? I got up at 3 o'clock in the morning and I thought maybe I can do this or maybe I can do that.
Right,
so you're always thinking about it.
I do. And I think that it shows in the outcome of our patients. It really does.
And so really many of the patients have been helped by your protocols.
Absolutely.
And doing what you do.
Absolutely.
And that's the bottom line.
I think that's the bottom line, and that's the joy I think I get. My nurses, my staff, they all get it. The lovely Linda's been with me for 26 years. So, and I'm not giving away her age because she was
12 when she started.
She looks darn good. But the point is, we have seen, and it's sort of nice to have somebody who's been with you from the absolute beginning, because we don't spend a whole lot of time in the past. We like to spend it today and in the future, what we're doing. But because we have the data build up and how we use things, I'm able to reach back in, and Linda and I may talk about it, and the docs and the docs I have now are relatively new to this, maybe been with me 5 to 7 years. So they laugh when they look at some of the old files and said, man, how did you guys do this? And I said, the brilliance of my physicians. For that, I am forever grateful.
And with that, we will pause for a break here. It's the halfway point of the show. It's Health Watch every Sunday, 8 until 9, right here on Talk Radio 1210 WPHT. I'm John DeMasi with Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210 is our number here in the studio. 855-839-1210. We will come back with more of today's edition of Health Watch right after these words. Welcome back to Health Watch. Operators standing by right now at Innovative Medical Associates. And the number, 856-489-0505. That's 856-489-0505. And don't forget the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Our show is Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. 855-839-1210 is our number here in the studio, 855-839-1210. So before the show, Dr. Molly announces to me.
Just in the morning, in the AM.
It never stops, right?
Here's the thing, John. We have this week coming up, and next week, I guess it's 2 weeks in a row. We have patients coming in from out of town. Wednesday of this week, I have patients coming in from California. Monday, which is tomorrow, I have patients coming in from North Carolina, and part of their family also is from Canada. So these folks are coming in together tomorrow. And that starts the week. And unfortunately, when people have some serious conditions and really depend on some of the nutraceuticals for their quality of life, and they go elsewhere for them because they're out of town, they invariably come back to me because they feel the difference.
So they could obviously from Canada. They could go anywhere.
Yeah, sure.
There
but-
must be.
And North Carolina as well, and California, the land of all the anti-aging in the world. But the point is, they themselves have said, I feel the best when I get tuned up at your place. So they really come back on a regular schedule.
And why is that?
I would say, again, it has to do with the quality of the nutraceuticals, meaning the products I use, the synergies of how I use them, and I think it also has to do with the wonderful people I have working with me. They are great.
Would you say, well, I guess you would say, that your protocols are unique
They are, because...
anywhere?
Right. They are unique in what kinds of combinations I'm clinical dosing of certain pharmaceuticals. And when I say subclinical, I'm talking about physiologically re-regulating. So it's much, much smaller than a traditional dose. If something is a dose of 50, we might use 0.5. It's amazing. It's amazing.
855-839-1210, again, our number here in the studio. And we always tell you call early because we don't want to not take your call at 8:58, which sometimes you do.
Yeah.
855-839-1210. So I noticed this week, and I hope I can explain this properly, MSCs,
yeah. They're cells.
their cells are
Right.
in conjunction with cellular biologics.
Well, actually,
What does that mean?
It means that we use a combination, and we use it as if we're doing PRP, which is the platelet-rich plasma. And again, the physician, and she's great at it, she can inject your knees, your shoulders, that kind of thing, with certain mixtures that really can eliminate pain. However, it's the use of the hydration, a few hydration therapies that we use both pre and post the injection, that we believe we have a much better process, and it actually does help these particular MSCs do their job in the particular area where the arthritis or where the tear is in the knee, this kind of thing. It is a little complex. And again, we can't say you absolutely will be out of pain. We can't. But I'll tell you something. It's been very, very positive outcome, and I can show people by radiology how this has worked for them.
I was talking to your patient, Tim, the other day, and he was telling me, he said, I had it done.
Yes.
And I really feel much, much better.
And Tim had some comorbidities. He had COVID. So believe me, he did have it done. And he's feeling so much better, and I think that's great. That's the bottom line.
So you were doing several the other day.
Yeah, I had 3, I think.
And so I just thought that was interesting and something we should point out.
Sure. Well, we kept the good doctor busy that day, didn't I? Yeah, I did. I kept not just the girls on the floor, but the good doctor got busy. And that was right. Here's the thing. We have a lot of tools in our bag. And many times, John, we can't talk about all this on air. But if people come into the office, I will happily talk to them because I know that everything we do, it's how we do it. It's the other items we use with it, the other nutraceuticals, the other amino acids, whatever we're doing. We have a protocol, which means we have a beginning, we have a middle, we have an end. And that's the bottom line. I mean, we have a recipe for health.
These procedures you've done, I mean,
I haven't done them.
The doctors has it, but you've done several.
Many at this point.
They all seem to have worked for the patients.
And if they haven't worked 100%, they've worked more than 50%, which is big if someone has a tear, etc. And when they come back for a second procedure, generally it is healed.
People have had surgeons recommend.
Yeah, of course. But this is something that, again, it takes some help from the patients too, John. You can't just go running out and start running your marathon again on your knees. It's not good. Or carrying some heavy stuff on your shoulders. That's not good. I mean, there is a process by which we need help. And we're also going to give you some oral vitamins and minerals and amino acids to take it home, and we would like you to do that.
How long, or should I say, do you get this done once, then maybe you get it done again, or what's the
Yes.
situation?
Yes, you may have to get it twice. But remember, we're creating our dear friend inflammation. When we inject, we're creating inflammation. So we want that inflammation. We want it to happen. And that may take 3 to 5 weeks for us to know whether we need to do another shot or something. And that's the art of this, John. That's the art of this.
Yes, it's fascinating because, I mean, before you were doing it or before it was done, you would have never thought of this.
No,
I mean,
people didn't know about
people
it. But
didn't know about it.
listen, it's being done all over Europe. It's being done in South America. By the way, it's being done in South America for some ungodly amounts of money that people are going, which I'm sure they're paying more for their spokesperson than I'm paying you. And I love you, okay? What I'm saying is you do so much for me based on what I've done for you, and
Yes.
I appreciate it. What I'm saying, some of these guys, no, man, it's all about the money. You know that.
Well,
You're in the biz.
You want to go to Dr. Molly. That's
I
for
know,
sure.
but you're very kind.
855-839-1210, again, is our number here in the studio, 855-839-1210. Is Luka Koven the Prime Minister of Israel? Or,
No, but he could be.
He could be.
No, but interestingly enough, one of my patients went to a spa and they said they had a weight reduction. Very, very interesting weight reduction hydration. And they used, in addition to some of the stuff that I would use, it's used in combination with chemotherapy. It increases the survival time for people with colorectal cancer. However, you shouldn't use it many times. It's really just a form. Let's say it is a pharmaceutical form of folic acid. Well, you know what I believe.
Yes.
I believe why not use folate and just ignore that. But we have used Glucocoven when the doctor has ordered it. But we're using it in doses that are infinitely smaller. Like a regular dose could be 100 milligrams to 500 milligrams using it traditionally. We might use 0.5. We might use 0.25. So what I want to say is you've got to be careful. Yes, the lack of folic acid can cause anemia, decrease in the red blood cells, oxygen through your body. But you've got to be careful, making sure that the patient isn't, for example, have a type of anemia that's caused by B12. You don't want to do that kind of thing. So these are the things that shouldn't be being done in a spa-like setting. What I'm saying, this is something, when you use subclinical doses of pharmaceuticals, you want to make sure that the doctor has reviewed the chart and the protocol.
And that's what you're using, of course.
Man, yeah, of course. We're not, forget it.
So this is a form of vitamin B?
It's a form of vitamin B. It's a form of folic acid. But my point is you've got to be careful how you use it because traditionally they're using it in high doses. Now, what I assume is and I can't say for sure because I didn't see the fat burner protocol that this person was taking, but he told me they definitely put this in, and I said, well, what happened? He said, well, I had a reaction. I said, well, don't go back, right? And he said, no, I won't. But my point is, if you see what I'm saying, I want people to realize you don't just.
How many times have people come into you with the bags of nutraceuticals?
Oh, gosh.
And then you find out. Remember the patient way back when who was taking something and it was loaded with niacin.
Yeah.
And they didn't know it. And they said, whoa, oh, wow, I didn't know that. And you explained it to them. And then they had to throw that nutraceutical away.
And what was happening was that he was flushing all the time.
Yeah.
He goes, I'm pretty sick, doctor. I said, you're pretty sick from this. There are many things, and again, I'm going to tell people a physician can use a pharmaceutical off-label anytime they deem necessary. My point of talking about this particular natural substances, but our first priority is to use folic acid. Why would we want to put somebody on a pretend folic acid if we don't need to?
Yes.
That's all.
We're coming up on a break here. It's our last break of the show. 855-839-1210 is our number here, so you still have PH.D. Again, 855-839-1210 is the number. With Dr. Molly Fantasia, I'm your host, John DeMasi. We return with more of today's Health Watch after these words. Back here on 56-489-0505 is the number is the number. 489-0505, and you want to call them and really make an appointment to sit down with Dr. Molly. The initial consultation is complimentary, and she will explain the whole thing to you as it pertains to you. 856-489-0505, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. Don't forget, we have our Health Watch replay this afternoon from 4 until 5. If you missed any of today's show, you'll catch it this afternoon from 4 until 5 right here on Talk Radio 1210 WPHT. 855-839-1210 is our number in the studio right now, 855-839-1210. And we want to talk about inhalation therapy, Dr. Molly. What's that?
Well, it's easy, okay? If anybody who's used a nebulizer, whether you've had asthma or allergies or that kind of thing, we're putting together, we have a protocol together to utilize certain nutrients through inhalation, and that's to help people through post-COVID. I am getting so many referrals, John, from physicians to help their patients through post-COVID. The fatigue in general and the lung, not being able to take deep breaths, this kind of thing, even though their lung x-rays are normal, although they may have some scarring from the COVID. So I was looking at some of the data out there, and I wanted to see, well, how could we enhance that? And so I put together a protocol, had the doctors review it last week, and I think we're about ready to utilize it, and I utilized it on myself already, and it seems to be doing the trick. There's no downside. However, I want to point out that in a facility like ours, John, we won't just do the inhalation therapy. The inhalation therapy gives the lungs a quick hit, let's say with glutathione, which we know is good for lung and brain. But we might, in fact, we will be using some IV treatments post that to help for the long haulers. And this is the key. So it's just another way to deliver the nutraceuticals that actually can coexist with the hydration therapy.
Okay, you wanted to give us an update on some of the patients?
I do. And you know what, John? I've had a lot of patients come in this past week over the election, the stress of the election. Yeah. So we had
you have anything for that?
Yeah, we do. We had to give them some hydration to reduce oxidative stress and to help bring up their mood. And then, of course, we had the other side of the coin, but I would say the majority. So what I needed to do was improve focus and concentration and get them back in the pink so they could get to work and we can move ahead with our health. So that was one of the things I had. But in terms of my cancer patients, I had two that also went back for their PT and their PET scans, and both PET scans stayed exactly the same as 3 months ago, which means they've had. We look at that as keep the patient going through their traditional and we were able to the tumor burden, and that is very, very important this week for a woman who had ovarian cancer 4 or 5 years ago, and apparently the surgery did not really get all of the tumor burden out. And so she came to me. She was a referral from one of my medical directors who was her neighbor. And
okay, we had some technical difficulties, as they say in the biz. So we're back. Okay. And where were we, Dr. Molly?
I was just saying that this particular patient needed some of the specialized testing that we can do to share with her, and then she can do what she deems necessary. In the meantime, we're going to be doing some supportive care to help her through her chemotherapeutics.
And any other patients that you wanted to give us an update?
I'm working with a nice young woman right now with anxiety and depression. She had a couple of good days, and I think that part of her issue is hormonal, and we're working on that as well. And again, this is not an instant thing. This isn't holy water, guys. We don't throw it in and you walk through the waters and you're changed. Nah, it doesn't work like that.
So it's a process.
It's a process.
Is the best way that you can explain
right.
it.
It's a process.
That it takes some time.
Right. It takes some time. It takes time on our behalf, and then it takes some movement on the patient side too.
And what can you tell people? The process. What can you say? 5 weeks, 10 weeks?
To 10 weeks, depending on how long you've had the challenge, what are the comorbidities with the challenge, and how do we approach this in a way that is synergistic with everything in your life.
And then after the 10 weeks.
And you want to go to a maintenance dose, and if you start to feel like things are creeping back up, come on in. Yeah. Let's get it done.
So it really is a long-term process.
It can be, but I'm not saying I want to go steady. What we have accomplished. That is the most important thing. And that's really true with conventional. People stop short when they start to feel better on their antibiotic or whatever drug they're on, and then they stop it.
Stop taking it.
You can't do that, folks. You've got to give the thing time enough to work so that, your life comes back to you the way you want it.
So don't stop.
Don't stop.
That was a song, but it also applies to Dr. Molly.
It applies to everybody for all kinds of medical issues. Don't stop.
And with that, we're going to put the wraps on another edition of Health Watch. Don't forget, if you missed any of today's show, 4 o'clock this afternoon, the Health Watch replay 4 until 5 on Talk Radio 1210 WPHD. And operators standing by, and they'll be there well after we leave you at 9 o'clock. 856-489-0505 is the number. 856-489-0505. And the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, Catherine, and Lana, those are our nursing staff, Joanne, fabulous Fran, delightful Dee, and our medical assistant, caring Kathy, I'm John DeMasi. Thank you for listening. We will do it all over again next week. Health Watch, 8 till... You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.